So it's complicated, but there's definitely progress. And then I guess the final thing people may have read about, there's been 2 large-scale studies, one out of India with 80,000 children, the largest study so far. It does suggest that certainly teenagers have a high risk of transmissibility. People know India's probably had the 2nd highest death rate behind Brazil and the US, so 2nd or 3rd behind those 2. So they've unfortunately had a lot of experience, huge population. And so that does suggest that the rate of transmission can still be very, very high among kids and especially teenagers as well. So we are learning more data about it. So anyways, I'll leave it at that in the interest of saving as much time as possible for questions. I guess the final thing is, where the heck are we? And the problem is we don't know as much, because the numbers that are being reported are still some of these old backlog testing we're making up. You're actually reporting positivity or negativity from days ago now. So we don't actually have the same comfort from the testing of what's happening today in Ontario. That said, I think we do know that probably in parts of the city where we're doing some more high vulnerable testing, we're seeing incredibly high rates, like 10% rates, which is just staggering. At 1.5%, we start to get worried. At 3%, it's serious. So when we see parts of the Toronto area with 9, 10, 11%, even 15, I've seen in certain postal codes, that is just staggering. But your daily running to CBC to see how many positives were in the Toronto area, that number is not very useful right now. There's real instability in that number. So what we're looking at is death rates, ICU rates, hospitalization rates, and then cluster sampling in high risk or other areas. And the overall trend is certainly worrisome. And so as the Premier said, going into this weekend, really get down to those tight household numbers. This is not the time to bring a big Thanksgiving together. This is, hopefully people were responsible over Sukkot and Yom Kippur, because there's a high degree of community-based transmission right now. And the healthcare system is not in crisis, but we really need, we got to be super tight. And you can't rely on the number and say, oh, we're down to 400, because I don't think right now for the next 5 to 8 days, I don't have a lot of confidence in those numbers. I'll be watching a constellation of data to help inform where we're at. So I think it's important.
Thank you, Joshua. Thank you, Amy. I have questions that came in prior to us being on tonight. If I could go through them and direct them to each of you, that would read a couple of them so you get some sense of what they are. On good weather days, for those students that have lunch recess in the gym, can they not walk to a local park instead, taking advantage of the outdoor spaces near the school and allowing the kids a break from mask wearing? That's one question. Similarly, about having unstructured time in nearby parks. And those are the parks questions, if you could sort of take those.
Sure, I'll start, and then Rena, if you want to add anything, because you're here, correct me, that would be good. So the way I think we've organized it is, sorry, the dog, I have no other options. The way I think we've organized it, the kids who have lunch or a recess in the gym are still on the roof 2 other times a day. And that is often the day that their classroom is trying to take them to the park. The issue with taking them to the park over their lunch is that they really only have 30 minutes. And because of coverage and the way our coverage and our contract with our teachers is designed, we can't extend that middle recess longer than 30 minutes with the same teachers. And the green space in our local neighborhood isn't cooperating with us. So obviously the field is still under construction, and the small parkette that is closest to us behind UTS is also under construction. So our options right now for parks are to either go to Sibelius or to go to the Huron Street Parkette, which for little feet is still a good walk away, or to go, there's a park south of the school. I'm not quite sure where it is. But by the time we got the kids out of the building and walked them to the park, we'd be talking about, maybe 8 to 12 minutes at the park before we turn them around and walk them back. And we're really giving some critical thought to how it is that our kids are actually walking to the parks, whether or not that's a masked or an unmasked time. Because our kids aren't doing a great job when they're walking together outside of keeping distance. They like to be together and talk to each other. And so different teachers are playing that walking time a little bit differently, either really enforcing distance and letting them have their masks off, or asking them to keep their masks on while they're walking. It just depends on who's walking with them. So taking the kids to the park at lunch until we get that field back, or until the parkette opens behind UTS, is just proving to be really difficult from a supervision and time standpoint. And so on the 1 or 2 days that the kids are in the gym for their lunch recess instead of on the roof, those are the days that we're trying to get them out to the park. So for example, grade 3 was at the park yesterday afternoon and this afternoon. With this nice weather this week, we know that our teachers are taking advantage of going to the park, and many parents have come to me and said, if you need extra supervision, let me know. And our parents know that, so that if they feel that they need additional supervision to get kids out to the park during their longer blocks of time, we know that that's available to them, and it shouldn't be supervision that's stopping them.
Okay.
Rena,
Joshua,
do you want to add anything?
Sorry.
I think you covered it.
Okay. Need to stop now.
This is for Joshua. Some questions about mask use and other mask-related questions. It's clear COVID cases are rising, which is what you talked about. Is the growth as fast as in the spring or in Italy or the US, or are masks helping? To the extent that you know, how safe are the kids with masks in the classroom? And should they avoid removing their masks at all times and eat outside? And of the cloth homemade mask types, do you know if there are better or worse ones, like double lining or different materials? So masks.
Yeah, a bunch of questions on masks. I mean, I think the most important thing on masks when it comes to materials is less the, like, I've seen some really sort of chiffon-y, sort of gauzy, almost like doily type things, or, you know, some pretty transparent gauzy stuff. I would try to avoid those. I mean, you know, just imagine your kids had a sneeze or a cough, or, you know, and just imagine your hand outside. If you feel like you could get moisture through that material, it's probably not a great material to use. So these very light gauzy things, but other than that, any of these cotton masks or neoprene or cotton, I think it's all good. I think it has less to do at this point with the material. Oh, the other thing is you can't use the one with the filters. I'm still seeing, I haven't seen kids with them, but I've seen parents with them in the morning in the lineup, although there's less of that now that we don't temperature check. Congratulations, Amy. But those ones with a purge filter, that's fine for construction where you're trying to keep the inhalation of sawdust or, you know, in from coming in. And it's great for scuba diving. But those purge masks are useless because they just purge out. So don't use those. But the real problem we're having with masks is inappropriate use. You know, it's the hands going up underneath, it's the pulling them down to talk, things like that. I do think our kids are getting better and better at them. And I think the school has been very thoughtful about where the kids are using them. So I think probably the material is probably not a huge issue, but again, use the cotton and neoprene stuff. And my guess is when the school's allowing it is probably pretty reasonable and well thought out. But I do think we just, like any other skill, hand washing, like any other thing that we try to get our kids to do, clearing their plates, putting their underwear and their dirty clothes in the laundry bucket, all of those things that we try to improve our kids' daily habits on. We just need to gently coach them. And so, you know, I'm out with my kids on the weekends when they're wearing masks, and I'm always just gently, you know, just helping, reminding and educating. And I think that's really helpful. It's unfair for the teachers to bear the full burden of that. So the more we can help them just with that proper mask usage is really important. You know, it's hard, right? I've seen kids reach up underneath and wipe their hand under the mask and then bring it out and then whatever. It's just, it's hard not to, but the more we can help with that, that's really where the masks are beneficial. I think in the system, I think I'm still, you know, I think most of us are good, but I was watching people in the grocery store, and when they think people are not looking, there's still a lot of one ear dangling. There's people taking it off to use the cell phone, people pulling it down to speak, and then pulling it up. I saw a funny thing very, very early on, which said the masks are like underwear. Put on a clean one every day. Don't play or remove it during the day. And if it gets dirty, change it. And I sort of thought it was a very funny tweet, and it's sort of true. Like once it's on, and you just sort of suck it up, right? And that's it. And once it's on, you're not playing and moving, and it's on, it's on. Don't fidget as much as you can. And that's for adults more than anybody else. And even in restaurants, I'm very mindful of it. I go in and I'll leave my mask on until I've ordered now, and then I'll sort of take it off. And, if it means I'm, a few minutes later and taking my first sip of water that they bring to the table, that's fine. But like, I'll leave my mask on until I'm done my interaction with the waiter as much as possible.
And don't share it. I think that was the last thing about the underwear and the masks.
Yeah, no, I hadn't gone there, but Jay, that's helpful, and tells me a lot about your youth, maybe your adulthood as well.
Fair enough. Amy, you noted in your intro talking about the PD Day coming up and preparing for the future, right? We're comfortably in the now, like preparing for the future. This question is, are you expecting another lockdown, either externally or self-imposed? And will this be based on numbers? Will it be soon? I guess the pressing question is, how do we decide what we're going to do? How will we be mandated? Will it be on our discretion? What are you thinking about?
So here's the good news. We're not the first school. So we're not going to be the test zone. And we don't know, if and when this is going to happen to us. What we've seen happen in the community around us is that we've seen cohorts be shut down. We've seen sort of double cohorts, like classes, be shut down. We've seen campuses be shut down in the public system. We've seen schools be shut down if there's an outbreak. And so at this point, I continue to say what I've said before, which is really, we will continue to take the direction of public health. And should we have a case or cases of COVID in our school, in students or staff, public health is going to intervene, and they're going to give us direction on who needs to close, how long they need to be closed for, if the whole school needs to be closed, and how long we all need to be closed for. And so, we're not going to have a self-imposed closure. That's not what we have planned. We will continue to take the direction of public health and continue to act out of an abundance of caution. So our approach to regulations as they have come from the ministry or from public health is to make the most cautious interpretation. Our pattern has generally been that when the ministry has tweaked regulation, we've sort of been 3 or 4 weeks behind to loosen up. And so I can imagine if whatever direction we would be given, we would take seriously, and we would make sure that we were acting with the most caution. And I feel grateful for Joshua. I saw Julia Orchid on the phone on this call, and other members of the medical advisory panel who are going to be with me, be with Molly, who's our amazing public health nurse and has now been through this, right? One of the other Jewish day schools has navigated through students with COVID-19. They've navigated through cohorts closing. And so we've learned from our peers in other day schools, through the public system, through the independent system, and we know that we will have all of the support we need to navigate through it, and we will follow the direction of public health. When I read that question, I really thought that I was the wrong person to answer it. But right now, all I'm saying is that we will continue to follow the direction of public health. We will continue to be advised by our nurse, by our medical advisory panel, and to react with as much caution as we can, while still weighing the tremendous necessity and benefit of having as many students and teachers in school every day as possible.
Great. Thank you, Amy. Josh, when I read this question, it's for you. I'll tell you what I thought it said. It said Toronto Public Health is asking us to decrease our bubbles if kids are in school. And the question was, is there an attestation or a role for this to ensure our community is following along? I thought it said asking us to decrease our bubbies, not bubbles. But how do you think we approach that, sort of thinking about our own community and what Toronto Public Health is saying, which is different right now than what the province is saying?
Well, I'm not sure they're that different, to be honest, respectfully. I think they're pretty aligned with the exception of one or two areas. I think the concern is if we don't reduce our bubbles, we will reduce our boobies. So that I think there is actually a link there. And, you know, 10 people died yesterday in Ontario, which was the highest that it's been in months and months and months. And so 10 people dying is unfortunate and a lot. They were all over the age of 75. So, you know, that underlying demographic remains a truth of this disease. And as we, you know, hopefully people, like I said, were thoughtful during Rosh Hashanah and Yom Kippur, and we're responsible on this weekend ahead of us. I think it's just really important. And I do think with a high level of community spread, we've really got to sort of back it off again. I know it's harder to sit out on porches, the weather's getting colder, but you really, you know, you got to maintain the physical distancing. And I don't think, you know, until we can sort of figure out where this is and see if we can back it down. I think the only area where I see differences or tension between the province and Toronto Public Health is really around the closure, the broad closure of restaurants versus the narrow closure of restaurants and other settings. And the other areas just around contact tracing and stuff. But that doesn't apply to the question in hand, in my view. I think we really need to keep our, you know, as Isaac Boxovitz said from UHN, you know, if they're not under your roof, they're not in your bubble. And I think that's perhaps a little extreme right now, or it's a little hard with our kids in school, but it's a useful rule of thumb. It's a useful guiding principle right now. And it's tough because our kids don't want to go back and we don't want to go back. But I think for the next 3 weeks, ideally 4 weeks, two cycles, two-week cycles is ideally, we'd ask people to really crunch it down again, which will allow us a little bit more breathing room comes Hanukkah, right? If we can tighten it down and flatten it out again, it'll give us a bit more breathing room later.
Joshua, to that exact point, there's been a couple questions about the Chief's Officer of Health in Toronto and thinking about, I guess, restaurants, gyms, and travel this weekend. So if you could take, I don't know if you want to take them all together, but.
Yeah, I mean, I think again, you know, I think people need to exercise common sense. We know what the rates and what's happening. And I think people really should be, like, to the degree you can. I would try to take the next 3 to 4 weeks to really go back to the practices you were doing, you know, more delivery, more eating at home, more delivery to your houses, etc. Smaller groups of people, like I said, you know, less social gatherings, even if they're in your, you know, in your house. And so I think this is a time back to the, you know, some of those other fitness options. There are a lot of online things. I appreciate not everybody can afford a Peloton, but I'm certainly very clear on that. But there's a lot of online programs with a lot of different exercises. There are still some nice days. So the more you can avoid those indoor gyms, and if you have to go to the gym, avoid the classes. Like those are just avoid the classes. They don't have HEPA filter. Like it's just not good. So, you know, I know some people can afford or go to these private gyms where they leave 20 minutes before people. And if you're able to be in that position, great. But these large indoor fitness classes, I think I would not do for the next while. Restaurants, you're going to have to call it. The outdoor is still fine if you can tolerate the weather. And you're going to have to see, you know, I'll be fully transparent. We went by a completely empty restaurant. That may have told us something else. We sat at a certain table, we got in, we got out, and you know, it was a risk, but we did a calculated risk, but we're doing way less of that. So I think I've been in 3 indoor restaurants in, I don't know how long total. And it's just
Okay.
not the time.
Okay. Amy, this is for you. And these two are sort of together in sort of policies and screening. Why in the screener do we have to answer how we're getting, I guess, to and from school? That's one question. And about the amended policies, you mentioned them sort of at the beginning. Like if my child has only a runny nose, what do I do?
Okay. So you have to say who's taking your child to and from school in the event that there was a COVID positive case in the school and your child was a close contact of that person. We would have a sense of the contacts that were around them. And so one of the pieces of data that we've been asked to collect, in addition to, you know, students or faculty in the school are unwell and the symptoms they've had and how it's being resolved, we've been asked to collect data on how kids are getting to and from school. And so that's why we're asking for that data. In an operational way, because we've changed our dismissal and we're dismissing right out to Bloor, it is much, much easier for us to sort of have that data of how kids are getting home and who's picking them up. Not that we're using that religiously, but it's just making that easier for us to have that knowledge. But the reason we started to collect it had to do with contact tracing from public health. So the next question, and I'm so glad that Molly jumped in just now. Molly has joined our call. Some people have probably had a chance to speak to Molly on the phone. Molly is the public health nurse who is working for Paul Penna Downtown Jewish Day School, Robbins Hebrew Academy, Leo Beck, and Nativot HaTorah. So we are all sharing her equally. She works for us. I mean, it's supposed to be 4 days a week. It's more like 9 days a week. And she's fantastic and really helping us to understand all of the policies and protocols that the ministry has in place, that Toronto Public Health has in place, that we have in place, and how all those things go together. So Molly, I'm going to try to answer this question and you can tell me if I answered it correctly. The question is, my child has a runny nose. What do I do? And so what we're still saying is if your child has just one symptom, please, you know, watch that symptom and do not return to school until that symptom has resolved or, you know, considerably resolved, and you have one of 3 indicators of health, either a negative COVID test or some sort of an indication from a family physician to say that the symptom they're experiencing is not related to COVID, or clearance from Toronto Public Health. And so that's what we're asking for before kids can return to school. What the ministry has released as part of their screening is that if children are experiencing one of what I'm calling a tier 2 symptom, so something other than fever, cough, or shortness of breath, maybe there's something else on that list, but I think it's those 3. So if they have a runny nose, or they have a headache, or they have a sore throat, or any single item, that if after 24 hours that symptom has resolved or is starting to resolve, they can come back to school. And we're just saying, before we go down that road and start bringing kids back to school after 24 hours with just a single symptom, we're gonna wait it out and be a little bit cautious for a few more weeks, watch to see what happens in the environment around us. And that's still with a single symptom, we're asking for a little bit more confirmation that in fact the child is healthy and ready to come back to school and isn't going to be spreading whatever they have to their classmates. Molly, how did I do? No, you have to unmute.
Yeah, that sounds great. That's that isn't the new guidelines, but that sounds like a good safe plan to me right now.
So that's where we're at right now.
Thank you, Amy. Thank you, Molly.
And sorry, just to add one more thing, my intention is that the week of October 18th, we're having meetings of the medical advisory panel and meetings of the pandemic task force, and all of our lives would be easier if we were to say, with just one symptom after 24 hours, if you're getting better, come back to school, you don't need any evidence. And so I don't know that we're not going to go down that road. We're just not going down that road today. And
I
we're
will
going to
say,
watch and see and explore.
and I'll say I'm the one that bugged Amy probably. With Netivet, we've had 3 positive cases, and they've been in the JK, SK, and nursery, unrelated, all 3 cases. And if we had followed these new guidelines, they would have all been in school. One had a cough only 1 day, one had a runny nose, and one had a headache. So it was flukes that the 3 of them got tested at different times. It was just related to them being in contact with someone, or a sibling was getting tested that they decided to get tested. But I almost let one of them back in school on Thursday. The one that had the cough on Sunday, Netivet is closed for the week because of the holiday. Thursday morning, the dad emailed me and said, we still haven't got his results. He hasn't had a cough since Sunday. Can he just come back? And I almost let him, because it was 1 day, he's going to miss 3 weeks of school. And I was like, no, we really, once you've had that COVID test, we have to wait. And an hour later, he emailed me and said he was positive. So if we had let him back in, that would have made things a lot worse for the class, for everybody. So that's what worries me with these changes.
Thank you, Molly. Thank you, Amy. Amy, to you again. Can you, the questions about mask policies and mask breaks, can you describe what that is, when kids get to take their masks off? How is that being handled when they're outside? Like, can you just go over that, please?
You know, we're really trying to strike a balance between mask wearing and distance. When kids are eating and drinking, obviously they're taking their masks off. When kids go outside, they have the opportunity to take their masks off. We are asking them to keep their distance from their friends and their cohort mates. Some kids are choosing to keep their masks on when they are outside, either because they know that they're closer to friends than they should be, or because they don't have a safe way to store it and they don't like what their options are. And so it's easier just to wear that mask. But 3 times a day, most days, most kids are outside, and that presents them with the opportunity for a mask break. And, you know, 3 or 4, or for some kids, 7 times a day, they're having snack breaks, and that presents them with a mask break. There are times when we know kids just need a mask break. And so a grown-up who is with them will say, hey, let's just go out into the hallway, take off your mask, take a few deep breaths of air, there's no one else around you, and then go back into classroom. If a child said to a teacher, can I just have a mask break right now? We would say, we would find the right place and the safe place for them to go and take a mask break. So they're getting mask breaks probably 6 scheduled times a day between outside and eating. And kids are making different choices about how they're wearing their masks outside. Rena, do you want to add anything to that? No? Okay.
Can I ask you, mask-free gym? Did we start with that and now we don't have that, or no?
Mask-free gym. So when the kids are in the gym and they are being, very active, they're running around, it sounds counterintuitive. They're breathing heavy, they're really sweating, they can take off their masks. But if they're doing things like yoga or stretching or sitting on the bench while the other kids are wearing soccer, we're asking them to wear their masks. We've put sort of boxes in the gym so kids understand what their space is. And within that space, if the activity is appropriate, they can take off their mask. If they're staying on their mat, they can take off their mask. But when we find that kids, especially when they're having their recess time in the gym, are just sort of playing and running around and really close to each other and not having the instruction needed to keep their distance, we're asking that they keep their masks on.
Okay. Joshua, a question for you. Do you have any updates about the timing of potential vaccines and I guess the availability of them in Canada?
Honestly, not really. I mean, there's sort of 3 or 4 things. One will actually got one out. I mean, there are places in the world that are, Russia and China, I think, are both immunizing large numbers already. Okay. When will we get a Canadian approved one? Not sure. And then the question is, when will you get production? And there's just so many unanswered questions about when will you get, sufficient production. I know the government's bought millions of doses from different types of companies, hedge their bets across. I would like to think January, February, maybe. I suspect we'll have an announcement, we'll have a dramatic announcement by the end of this year. And then we'll start to see rollout sometime next year. But things can still happen, right? AstraZeneca had that patient who developed a disease called ascending myelitis, which is a bad thing. And, they're still learning about this. So, but my guess is we'll have a dramatic announcement before end of calendar, and then we'll start to see distribution in the first 3 months of the new year. But when will everybody on this call have a chance to receive it, and all of our families? That's a very different question. There's a whole prioritization framework that will come into place to help with the distribution.
Fair enough. Amy, the question is about how are we doing with student and teacher attendance? You touched upon it, I think, at the beginning. It says we had some tough days early on with the number of teachers out. Are things leveling off?
Yes, it was really touch and go after Rosh Hashanah. We were stretched thin with our teaching complement, and Rena and I definitely dusted off our teaching shoes. But really, I think, post Yom Kippur through Sukkot, our teachers have stayed healthy. They've done the things they needed to do to be rested and well, and they're really working hard to make sure that they stay healthy. It's not easy to talk with a mask on all day and just be so on and have that kind of restriction, and they're superstars. I know that a lot of them are on the phone and on the call, so thank you to them. They're working super hard, and our good fortune is that they continue to stay healthy. And when they're out for a day or two, right now it's only one of them or two of them, not 5 of them. So that's been great. And actually, Karen Goldstein in the office today told me that our student attendance was, I don't know what the statistics she gave me, but it felt like the best it had been. And today we had the fewest number of sick kids out. And actually today we didn't send any unwell children home from school. So that was fantastic. Molly, there's no more data for you on that chart. So this week feels good. I think that as we all just sort of adjust to being at school and figure out the things that we need to do to nourish our bodies and the sleep that we need to get to adjust to these schedules, and how we move through our days with this amount of speaking and mask wearing and making sure we drink enough water and all the things that we need to be well. Thank God we're staying healthy, and we had a full complement of staff and almost all of our students in school today, which was excellent.
It's great. It was great to have our kids not home. This is a question, it's sort of operational about how classrooms are working, Amy. What are your thoughts on kids, students viewing teachers on Zoom when the teacher is actually in the room? Is the goal behind this to create a common class community across the different cohorts with students at home? If so, are there any other ideas on how to accomplish this? You mentioned this was something for the PD Day.
Right. So I read this a few times. I think that what this means is, why is it sometimes that everyone, including the student, including the teacher, is on Zoom? And our teachers are playing with some different ways to teach, to include kids across cohorts and also include kids who are at home. Sometimes the teacher themselves is teaching from home via Zoom, and so it might be an easier modality for everyone on Zoom. We're also encouraging all teachers to just try this and keep kids' skills on using Zoom good and up to date, so that if they have to go to it, they know how to use it. And for some of our kids who are at home for a long term, those times when the teacher and all of the kids are on Zoom and they can see all those faces and they can see the full class, it feels very, very comforting to them. The other thing that's happening is that all kids in grade 4, 5, and 6 are having French on Zoom. And I think we now have all of our technology and headphones and everything in place so that each child is logging in independently. And our teacher, Marina, is finding it much easier to interact with the kids during French when each child is their own box, as opposed to her looking at the full classroom and a teacher sort of mediating the conversation for her. And so there is that period, 2 or 3 times a week when the kids are in French in grade 4, 5, and 6, and they're connecting into French via Zoom. The subtext here is if you haven't sent headphones for your child, or if your child is prone to losing things, talk to them about whether or not they have headphones. I think we're purchasing headphones, Cheryl, for all the kids in kindergarten 1, 2, and maybe 3, but we're asking for the 4, 5s, and 6s to bring headphones that make them comfortable and that they can use. So we're just trying different ways to connect. None of it is ideal, right? Having kids scattered and connecting to kids in different modalities isn't ideal, but sometimes for the teacher, depending on what they're teaching, or for the kids, depending on the set or the cohort, having everyone connected via Zoom is actually what's going to make the dialogue and the learning the easiest to access.
Great. Joshua, if I could go to you, a pretty specific question, but I know one that we're all going to be asking, if not this week, then in 2 weeks or 3 weeks. Now that it's cold, what do you think of indoor play dates with the same restrictions as they have in school? So in the same cohort, open windows, masks on, with distance, but inside in someone's home.
Yeah, I mean, I think theoretically that's reasonable. I think it's the practicality of that gets hard. Are you really going to have the windows open as the temperature drops? Are they really going to be able to physically distance? I mean, one thing you worry less about with the physical distancing outside is first the nature of the activities are more likely to bring them apart, just the nature of play that people do outside. And also there's just a lot more air circulation when you're outside as well. And so the question is, what are the activities they're realistically going to be doing inside their bedroom or the den downstairs that's going to maintain that? And I'm not saying there isn't, but it's just going to take a certain amount of mindfulness, if you will. So I think it's possible. And I think, again, it's all about calculated risk. It's all, and you know what, I would feel different about some of the older kids than I would do with some of the younger kids. And I would feel different about certain kids who are more or less physically active, or about the types of activities and all that stuff. So I think it's you're just going to have to make an informed judgment call with the other parents. And the masking will be important, and the wiping of the surfaces a bit. Entrance and exit will be important. But the masking will be really important. And again, thinking, what are they going to do for that 3-hour play date? Or whatever that distance, what like realistically, how are they going to fill that time? And is it time that can be filled physically distant? And are the kids good with masks and all that? So I'm not saying no, I'm not saying yes. I'm just saying you're going to have to think about what the kids involved, your risk level, the rest of your environment, the setup of your house. Some houses are smaller than others, some are bigger than others, some have better, open windows than others. We all live in different environments. And so it'll be a very individual choice.
Fair enough. Amy, this is for you, and maybe with a dash of Joshua sprinkled in. 2 questions, but they're quasi-related. One is about the possibility or the feasibility of doing private COVID testing at school.
Oh, you meant private COVID testing at school.
Yes.
I didn't realize that.
Sorry.
Okay.
Sorry. That was one question. I don't even know if that's feasible. The other is about a flu shot clinic at school.
Mm.
Okay. So I have nothing to say about private COVID testing at school. I don't even know if that's something that we could do. And if we went down the road, if we could do it, whether or not we would do it. So I'm going to say, come back to me with that question when the month starts with an N or a D, and maybe I'll know more and have more to say. But right now, I don't think I have anything to say about that. Joshua, are we seeing private?
Yeah.
Are we seeing this kind of COVID testing in school, and how's that working?
I don't know if we're seeing it in school, but we're seeing it at places like MedCans and all that. And it came up in question period today to the premier from the opposition.
Oh.
I don't think, I'll just be blunt, I don't think we should do it. I probably have a bunch of my own biases and values built into that blunt statement. I guess admit your biases. I have a bias against that for a bunch of reasons. But I don't, that's not where I think we should be looking in the immediate future anyways. Will I feel differently in 6 months? Well, maybe, but I don't think certainly in the next 6 weeks, I see that on the horizon. I reserve the right to change my mind, but today I would say that's not where we should be leaning in. On flu, Amy, you and I have chatted flu.
Yeah, so teachers are having a flu shot clinic, and Molly's going to be administering that. And we're really grateful actually to a doctor in the Nativot community who's providing the flu shots for all of the faculty in both school communities. So such a beautiful partnership that we have with them, and just a nice way that that's moving forward. And so we're just working with Molly to figure out when and how that's going to be administered. And I know that Marlene Tobe Schiff and Guy Aboudi on behalf of the PA are starting to work on what a PA flu shot clinic for students and families might look like. And we're just trying to figure out space and cost that would be attached with bringing in a service to administer that. And so as we figure that out, and whether or not it is in fact something that would be appropriate and affordable for the PA to do, we will be in touch with more information. I guess what I would say to families in the school is, if you have opportunity or plans to get your flu shot elsewhere, if that was part of your October planning, don't not do that, because there might be something at school. But for many people, a flu shot in the school building might actually be a really helpful and viable way for families to get flu shots. And Cheryl is working with the JCC to see if they will even entertain letting people in the building for that purpose and for that sort of short-lived experience. So we're definitely exploring that.
Karen pointed out that flu shots are now available, at least in a limited way as of yesterday, which is about right. They come out around Thanksgiving every year. I don't think there's ever been a year that I've had less clarity or certainty around what the heck is going to go on with flu this year. We do so much global trending, so by the time it gets to Canada, we've got a boatload of informed hypothesis. This year is a complete, we're working in a black box. And so I think it's critically important that people get their flu shots. For all we know, this could be the worst flu season we have on written history. We don't know. The normal data trends are not there, because every country's been going through different lockdowns at different times when the flu is percolating through and the data reporting's poor, blah, blah, blah. So please get your flu shot. It's a really quirky year.
Well, being super unpredictable is very on trend in 2020. So thank you, Joshua. Amy, I think we have about 4 minutes left. I have one last question that I thought would be a good one to end on, if it's okay. What can we do to better support our teachers? We don't want to step on their toes or make more work for them, but it's hard to know what they need from us when we don't see them. That is true.
That's such a nice question, and I was so happy to see it. So one of the things I would say is just keep sending your teacher love notes. So, send a quick email that says, "My child came home so happy today. Thank you for doing what you're doing." Have your child write your teacher a note and put it in their lunchbox, and they can, give it at lunch. I think those are appropriate for younger kids for sure. And sending a quick email to your child's teacher for older kids, just to thank them. If your child's home for a few days and you notice something great about the online learning experience, let them know. When your child's home digitally, you're going to have a vantage point into their classroom that you otherwise wouldn't have had. And and let them know what you see that's great. When they send their Friday emails home, write back and say, thanks for putting all of this information together. It really helps me, and, Shabbat Shalom. So just warm communication goes a really long way. I think that if we think about the kind of positive reinforcement that we like to receive, and we try to give that back to our teachers, for the most part, our teachers are going to be happy. I think something else that we can do, and this sounds sort of funny, is honoring morning time. And so what we're finding happening in the morning is that our older kids are coming to school early. So on record, this has never been a problem that Paul Penna has had. Kids coming to school early, not a typical Paul Penna Downtown Jewish Day School problem. But with our grade 4, 5s, and 6s not starting until 9:15, we're opening the doors for them at 9. And what we're finding is that by like 8:50, they're congregating, ready to go in. And those of us admin who are, we're on duty, we're like watching our watch. And so give your kids that extra 15 minutes to sleep if you can, if it's possible for older kids and younger kids not to come together. Older kids who come with younger kids are welcome to go in when their younger siblings go in, but older kids who are coming on their own, we're really asking that they come in their time slot. And so what happens when we send our kids up early is that the teachers end up sort of supervising at a time when they shouldn't be. It's really intended for many of them to be a quiet prep time for the day. And there's just way more kids in the school at that time than we had otherwise anticipated. And if the whole point of this was to spread out arrival so that we're not, blending all these cohorts together, we're pushing kids off to the side to wait, and they're all blended. So I would encourage people, traffic patterns have probably been established, and just think about what it would look like to really come in your window. So SK grade 1 is an 8:30 to 8:45 arrival window. Grade 2 and 3 is an 8:45 to 9 arrival window, and grade 4, 5, and 6 is a 9 to 9:15 arrival window. And I think if everyone just bumped them, not the kindergarten and grade 1s, you guys are perfect, but if the grade 2 through 6s just bumped themselves 5 minutes, I think we would be doing a great service to our teachers. And I would encourage you to consider how you could work that into your daily routine. But Shabbat Shalom, and teacher, you're doing great. And I noticed this, and this work came home, and my child mentioned that. Teachers love that. So just let them know that you notice the work that you're doing, and that you appreciate it.
Thank you. That is good feedback and good advice. I want to sort of end it there to respect Amy's time, respect Joshua's time, respect all of your time, but also thank you, Amy and Joshua, because and Molly and Rena and everybody else is on the call, because I find something, I can't believe I'm saying this, but something looking forward to be part of a community that gets really good information in real time, can ask really honest and important questions on the medical side, but also on the sort of operation side of the school and the education side. So thank you both. Thank you everybody for being here, and we will see you next time around.
Thank you, Molly. Molly was the great surprise of tonight. Molly's terrific. She's a wonderful addition to our faculty, and thanks for joining us tonight, Molly. That was great.
I think the more I understand your community, the more I can help them. So that's what I'm trying to, I'm realizing that.
Great.
And as always, if people want to send me private, separate questions, I've had some really interesting scenarios and questions brought to me. They're always good to work through, so don't hesitate to reach out to me.
Great. Thank you all. Good night, everybody.
And I recorded, Jay. I started recording at about minute 3.
I saw that.
We're good.
I saw it. Bye.
Bye. So I don't know what to do now. I just let it go. Molly, will you just stay on so I can ask you a question?
Yep.
Everyone else can go.